Hello, my name is Daisy Wang, and today I will be presenting my analysis of supervisory skills based on an interview with a professional social work supervisor. This presentation was developed for my SWK5017 Week 4 assignment and is intended to demonstrate my ability to analyze supervisory practice through the lens of CSWE competencies and advanced generalist social work principles. For this assignment, I interviewed Megan Doherty, a licensed clinical social worker who serves as the Assistant Vice President of Psychotherapy Initiatives at HousingWorks. Megan has been with the organization for over 10 years and brings extensive experience in both clinical practice and supervisory leadership. In her current role, she directly supervises 6 program directors, which means she provides leadership oversight across 6 distinct programs. Her work requires balancing clinical quality, ethical oversight, staff development, and organizational accountability across multiple service areas. Megan is also my site supervisor for my foundation practicum. By engaging directly with an experienced social work leader, I was able to better understand how ethics, engagement, intervention, and leadership theory are applied in complex organizational settings. Throughout this presentation, I will be analyzing supervisory strategies, identifying strengths and limitations, and linking practice decisions to relevant theory and professional standards. HousingWorks is a nonprofit organization based in New York City that provides comprehensive and integrated services to individuals impacted by HIV, homelessness, substance use, mental health conditions, and systemic inequities. The organization was founded on principles of social justice and health equity, and those values remain central to its service delivery model today. The agency offers a wide range of services, including permanent and transitional housing, behavioral health and psychotherapy services, harm reduction and substance use treatment, medical and dental care, legal services, job training, and advocacy. Rather than operating in silos, HousingWorks uses an integrated care approach that emphasizes coordination across disciplines. Megan's supervisory role exists within this complex service environment. She provides leadership oversight for behavioral health services across multiple programs, including the emergency and transitional housing, transgender-affirming clinical groups, and substance use treatment programs. This context is important because supervisory decisions are influenced not only by clinical considerations, but also by organizational structure, regulatory requirements, and the needs of highly marginalized populations. Competency 1 from the Council of Social Work Education focuses on ethical and professional behavior. Megan described ethical dilemmas as a routine and expected part of supervisory practice. Rather than viewing ethics as rare or exceptional, she emphasized that ethical decision-making is embedded in everyday leadership responsibilities. Some of the most common ethical challenges she encounters include maintaining confidentiality, navigating professional boundaries, managing dual relationships, responding to mandated reporting situations, and supporting clinical decision-making within organizational and regulatory constraints. These issues often arise in environments where clients have complex needs and where staff must balance care, safety, and accountability. Megan explained that ethical decision-making at HousingWorks follows a structured and collaborative process. Supervisors are expected to consult with leadership, document their decision-making, and involve interdisciplinary perspectives when appropriate. Ethical decisions are not made in isolation. Instead, they are approached thoughtfully, with attention to professional standards and organizational policy. The NASW Code of Ethics serves as the primary ethical framework guiding all professional conduct at the agency. Megan emphasized that ethical reasoning requires balancing client self-determination, professional responsibility, and organizational accountability. When ethical ambiguity exists, transparency, consultation, and reflection are prioritized over quick or reactive decisions. Technology plays a significant role in service delivery and supervision at HousingWorks. The agency utilizes electronic health records, secure clinical documentation systems, virtual therapy platforms, internal communication tools, and data reporting systems to support care coordination and accountability. Megan emphasized that ethical technology use is not static and requires continuous attention. Ethical concerns related to technology include maintaining client confidentiality, ensuring informed consent for telehealth services, protecting data security, and establishing appropriate boundaries in electronic communication with both clients and staff. The agency aligns its practices with the NASW standards for technology in social work practice. This includes the use of secure platforms, access controls, staff training, and clear protocols around documentation and communication. Megan noted that technology has significantly improved access to care and supervision, particularly during periods when in-person services were limited. At the same time, she acknowledged important limitations. Clients may face barriers related to digital literacy, access to devices, or stable internet connections. Supervisors must remain mindful that technology should enhance, not replace, relational engagement and clinical judgment. When analyzing Megan's ethical decision-making approach, several strengths stand out. One major strength is the emphasis on consultation and reflective supervision. By encouraging ethical dialogue and shared decision-making, the agency reduces risk and supports professional growth among staff. Another strength is the normalization of ethical discussion. Ethical concerns are not treated as failures, but as opportunities for learning and reflection. This contributes to a strong ethical climate and promotes accountability across programs. However, there are also limitations. Ethical consultation can be time-intensive, particularly in high-demand service environments. Supervisors may experience tension when ethical best practices conflict with funding requirements, regulatory expectations, or operational constraints. Additionally, while technology supports efficiency and documentation, it requires ongoing oversight to ensure it does not overshadow relational practice. Supervisors must remain intentional about balancing procedural compliance with ethical judgment and human connection. Competency 6 focuses on engagement, and Megan described her supervisory approach as grounded in empathy, cultural humility, and self-reflection. She prioritizes creating psychologically safe environments where supervisees feel supported, respected, and able to engage in honest dialogue. Megan is intentional about adapting her leadership style to the needs of diverse supervisees, programs, and communities. She acknowledged the importance of recognizing power dynamics within supervision and addressing them directly rather than ignoring them. Culturally responsive engagement is central to her practice. This includes acknowledging identity, lived experience, and systemic oppression, as well as being responsive to the unique challenges faced by staff working with marginalized populations. Emerging technologies support engagement across programs, particularly when teams are geographically dispersed, but Megan emphasized that trust and relationship building remain foundational. The strengths of Megan's engagement strategies include emotional intelligence, consistency, and a clear commitment to equity-informed supervision. Her ability to engage across individual, organizational, and community levels reflects advanced generalist social work practice. Staff benefit from clear communication, reflective dialogue, and leadership that values both accountability and support. These strategies promote staff retention, professional development, and effective service delivery. A limitation of this approach is the challenge of maintaining depth of engagement while overseeing multiple programs and leaders. Virtual platforms, while effective, may reduce opportunities for informal connection and observation. Megan addresses these limitations through intentional check-ins, structured supervision schedules, and layered leadership supports that distribute responsibility. Competency 8 focuses on intervention, and Megan described a supervisory approach rooted in coaching, mediation, and advocacy. When intervention is required, she prioritizes clarity, documentation, and alignment with organizational policy, while maintaining dignity and respect for the supervisee. In disciplinary situations, Megan uses a developmental framework rather than a purely punitive one. The focus is on identifying concerns, clarifying expectations, and supporting improvement while still maintaining accountability. Mediation strategies include structured dialogue, reframing issues, and collaborative problem-solving. Megan identified emotional regulation, decisiveness, and compassion as essential leadership skills during intervention. Technology supports intervention through documentation and tracking, but she emphasized that direct communication is critical for effective outcomes. Evaluation and follow-up are essential components of Megan's intervention process. She assesses the effectiveness of interventions through ongoing supervision, progress monitoring, and reflective feedback conversations. Follow-up includes revisiting goals, evaluating behavioral change, and adjusting supports or expectations as needed. This process reinforces accountability while also promoting learning and professional growth. The strengths of this approach include transparency, consistency, and alignment across programs. A limitation is the time and capacity required to sustain this level of follow-up in high-intensity service environments, which requires careful prioritization and leadership support. Based on the interview and relevant research, Megan's leadership approach aligns most closely with transformational leadership theory. Transformational leadership emphasizes mentorship, empowerment, shared vision, and professional development. Megan's focus on reflective supervision, staff growth, and values-driven decision-making reflects this leadership style. Transformational leadership has been shown to support ethical climates, staff satisfaction, and organizational resilience in social work settings. However, this leadership style also has limitations. It requires significant emotional labor and sustained relational investment. When leaders oversee large teams or multiple programs, there is potential for role strain without adequate structural support. In conclusion, this interview provided valuable insight into supervisory leadership within a complex social service organization. Megan Doherty's approach demonstrates advanced generalist practice through ethical decision-making, culturally responsive engagement, effective intervention strategies, and research-informed leadership. As both a graduate student and a supervisory professional, this experience reinforced the importance of reflective supervision, ethical clarity, and transformational leadership in advancing social work practice and organizational impact. This analysis has strengthened my understanding of effective supervision and will inform my own leadership development moving forward. Thank you for listening.